right, everybody, we're going to get started with our briefing today. Thank you so much for joining our February Ambassador Call. We're so excited to have you here today. To kick us off, we want to start with a round of introductions to the staff who will be joining the call. My name is Julie Eller. I'm the Manager of Grassroots Advocacy, and I'm really glad to have everybody here together today to go through our many ambassador assignments and tactics that we can follow throughout the rest of this month and next. I also have Stephanie Livingston here with us, Michelle Guadalupe on the state side, and Vincent Facilio, and they can do a little introduction of themselves now if they'd like to. Vincent, do you want to kick us off?
Hey everyone, Vincent Facilio, Director of Federal Affairs, and happy to be with you all today.
Hi everyone, I'm Stephanie Livingston. I'm the new Consumer Health Specialist, so I'm excited to be talking on my first webinar.
Yay! And Michelle, do you want to introduce yourself as well?
Sure. Hi everyone, Michelle Guadalupe, Director of Advocacy Alliance Development. I am out in beautiful, warm Midwest of Illinois. Not really, it's a little cold, but excited to be here and to see so many of you next month in Washington, D.C.
Thanks, Michelle. Throughout the call today, if you have any questions, you can feel free to put them either into the Q&A feature or into the chat feature, or at the end of the webinar, you'll have an opportunity to ask your questions live by unmuting your phone lines. But don't forget your questions. We encourage you to plug them into the chat feature as they come up, and we'll be sure to get to them at the end of the call. To kick us off, we want to give you just a brief update on what we're going to be talking about today. First, we're going to go through some institutional updates for ambassadors. Then we'll go through some policy updates on the state and on the federal side. And then we'll go through this month's activities for the ambassador program. First off, we want to recognize one more time the amazing accomplishments of our 2018 Platinum Ambassadors. This past year, we were so proud to have more Platinum Ambassadors than ever before. This year, we have 70 Platinum Ambassadors hailing from all over the country, from nearly 40 different states. I have a list of all 70 of our Platinum Ambassadors here, and we just wanted to take a minute to have these names recognized and available for all of you. These 70 leaders have had a really amazing time being dedicated and committed advocates across the country. We have some husband and wife duos in here. We have a couple mother-daughter duos in here. But mostly we have a lot of people who are dedicated to being the voice for the voiceless, people with arthritis who can't have their concerns heard for whatever reason. These 70 people really are our leaders in our community. So cheers to anybody who's on the call who are Platinum Ambassadors. We're so excited to have you here, and we're excited to set you up for success so that you can be a part of this Platinum Ambassador program again next year. To become a Platinum Ambassador, we have a number of requirements that these folks had all completed this past year and then some. We have regular ambassador activities. We'll go through a handful of them at the end of this call that are completed throughout the year on a monthly basis. We have bonus activities that really speak to our Platinum Ambassadors' skills and backgrounds. They can select these at will. And we have a fundraising requirement of $1,000 for the Arthritis Foundation. As we go through the year, we want to make sure that folks have the opportunity to stay up to date with us. Later today, you can expect to see a large update on our website, on our current ambassador assignment page, to cover the current assignments that we're going to discuss today and any of our past assignments to make sure that they're available to you so that you can get caught up. This year, for our 2019 Platinum Ambassador requirements, we're looking for 10 regular ambassador activities, 4 bonus activities, and again, that fundraising requirement of $1,000 for the foundation. And if you need help with that, we have 70 Platinum Ambassadors who accomplished that this year and did so really just with poise and grace and awesomeness, and so we can connect you to a mentor who would be willing to help and help you get to that point and get excited about this exciting program. The next thing I wanted to talk through with you is a brief update for our Action Center. So as you know, we have this new amazing tool on our website called our Action Center, and it's a place where many of you have sent a letter to your member of Congress, looked up your legislator, or even tracked legislation. And that's the tool that I want to talk with you about today. Our track legislation tool has grown a bit. This year, in our states and on the federal side, we're able to track specific pieces of legislation, so specific policies that we're looking at in your home state. We can go in here and track them on our end. And what we're committing to doing for all of our grassroots programs is to create, if ever there is an action opportunity that you can take action in our Action Center, we want to create the tool so that you can learn more about that piece of legislation that we're asking you to take action on. So it's quite simple. If you come into our track legislation section of our Action Center, you can search by your state to see if there are any key pieces of legislation, or you can search more broadly and use this drop-down menu to find your state and enter any keywords. So some of those keywords might be about particular policies that you want to understand more. Maybe it's step therapy or prior authorization. And when you hit search, you'll get that any bills that would come up from your state. But the bills that we're talking about today are our tracked pieces of legislation. So our team can go in and create these really, really cool resources for you, such that when you use your drop-down to find your state, you can see a selected bill that you might want to learn more about. Now, we only have a handful of these available, but I wanted to show you what Georgia's looks like right now. So if you search for Georgia, you'll see that we have a state bill on reforming step therapy. And by clicking into this link, you'll get more information about the bill. Excitingly, this will be pulled in directly from our friends over at the Georgia legislature. They'll have the exact bill text. And then you can see that the Arthritis Foundation supports this bill, and it includes an explanation about the issue and a space for you to take action. So it's a really easy space for you to come in and learn more about the bill. You can also see from here our sponsors list. So if there are members of the legislature who have already sponsored the legislation, you can see all of their names and the progress of the bill through the legislature. So it's a great tool. And let's say you want to reach out to one of these legislators through the Action Center, you certainly can. Just by clicking Representative Sharon Cooper here, you're able to see all of her information. You can get her Capitol address to write her some snail mail, or even her email address to write her a direct letter in your email inbox. You can see her social media information and even click in to more personal, political, and staff information right here. I'm now going to switch gears a bit into our state and federal legislative landscape. We're going to kick it off with Michelle Guadalupe giving us an update on state legislation.
Great. Thanks so much, Julie. We've had an incredibly busy start to our legislative session starting in January. One of the great things that we're able to do with the Arthritis Foundation is have state legislative days all around the country. So I just wanted to share this pretty neat slide. You can see where we've been. We've been already to Georgia, Maine, Kansas, and Virginia, and you may recognize many of the advocates and ambassadors on this screen. During these different legislative days, our advocates were able to partner with other patient and provider groups and meet with their legislators as well as many of leadership in the state legislatures. So some really great momentum across the country as well. You can see that we have a number of different state legislative days that are coming up later in February, including Washington, that was going on today, as well as you can see many additional ones throughout the next few months. A great thing, if you ever are curious of what was kind of going on in the state capitol that day, make sure that you follow that hashtag Advocate for Arthritis. Many of our team members and ambassadors are writing about their experiences through Twitter. So you can see we've been very busy, and we are just excited about what these next state legislative days will do. In addition to our legislative days, we actually had a legislative victory already this year. This was such a monumental victory in Ohio. It has to do with our legislation to help curb step therapy. I know that Julie will be talking a little bit about some of our efforts with step therapy on the federal level, but as you may have heard from previous ambassador calls, we have been working on step therapy legislation all across the country in our state legislatures, and this was really an effort that was 2+ years in the making. So just congratulations to all of our Ohio advocates. I know that the Arthritis Foundation advocates were very influential in getting the message across to legislators across the state. So congratulations, everyone. This is fantastic. We also, as I had mentioned, that we had a really busy start to the legislative session, and so many of you have been reaching out to your legislators. Many of our legislative bills have passed out of various committees, and we really consider all of that to be victories that were made possible for advocates. So on future ambassador calls, I know that we'll have additional updates there, and we just really are excited and want you to continue that outreach. And including on that, we have had so many different engagement opportunities. We've had advocates testify in Virginia. We have a few advocates that are ready to testify next week in Kansas. We've also had advocates who have been in touch with the media. We had a great step therapy article in Maine. We also just today in Washington State had a step therapy news article come out from one of our advocates. So you all should be really proud. This is all really helping the cause. And Julie had also mentioned the Action Center, and I can share with you that over the last 2 months, we've had almost 300 messages being sent out by our advocates and ambassadors, and they've been on all these different pieces of legislation that we've had in the states. And what was really great is so many of them were personalized. I know that is part of your training with the ambassador program, is to really make that impact by really sharing your story. So congratulations to everyone, and we really look forward to having more and more of those action messages being sent out. Many of you may remember at the beginning of the year we had a state update email that went out, and we just wanted to remind you that in there are a lot of different opportunities. We have some great state advocacy committees across the country, and again, if you have that story, we want to make sure that you're able to include that in our story bank so that we can definitely get in contact with you, and again, to move many of our pieces of legislation forward. So it's so great to be able to address you all today, and again, looking forward to seeing many of you in a few weeks.
Thanks so much, Michelle. We're going to switch it over for our federal update.
Thanks, Julie. Hey, everybody, this is Vincent. We have 3 quick updates to share with you on the federal side of things. I know it's busy state season right now, and so that's where all the action is taking place. We're still kind of in the beginning stages of the new Congress here that took their seats at the beginning of January, but we did have a few updates to share with you all today. The first, and is kind of the most exciting, is that we held our biennial Arthritis 101 briefing on February 13th, and I believe Bill Gillette is on the phone, and we thank him very much for participating with us on the Hill to share his story about his experience in the military and being diagnosed with arthritis during his service. We were able to reach almost 20 congressional offices as a result of this briefing, and are going to continue to beat the drum on the importance of finding dedicated research for arthritis at the Department of Defense. So that's that second bullet there on the slides. So that effort is really leading us into our annual appropriation season, where we're not only fighting for dedicated funding at the DoD, but we're also making sure that the CDC's arthritis program, which is the only federal program dedicated exclusively to arthritis public health research, is going to continue to be funded at robust levels to make sure that we can have the best understanding possible of the disease, because the CDC is the only entity that lets us know prevalence rates and impacts in congressional districts and all of the data that we use to really magnify the urgent public health priority around arthritis. The last item I wanted to touch on is building on what Michelle discussed about step therapy legislation at the state level. Once again, we're working hard to get the legislation reintroduced. This Congress, as you may know, in 2017, a federal bill that was modeled on a lot of the state legislation that we're working on this year was introduced by two providers in Congress. And we've been working over the last couple of years to really raise awareness about the impact step therapy can have on access to care. And so we're hoping to have that bill introduced in time for the Advocacy Summit when many of you will be here. And we'll be continuing to raise the alarm bells on how this issue is impacting all of you and everyone with arthritis. So thank you, Julie. Those are kind of the three updates from the federal side, and I'll turn it back to you.
Thanks so much. And these are just the start. We have some really cool action opportunities that we'll discuss in just a few slides that can kind of pair with each of these federal opportunities that we have here. Before we move into that space, we wanted to just make you aware that we have a really great new resource that's about to hit the presses for the Advocacy Summit. It's our Welcome to Congress packet, and it does a really good job of introducing Congress to all of the legislative priorities that are really important to us on the federal level. It covers arthritis in the military, as Vincent just talked about. It covers introducing step therapy in a really meaningful way. You can see our spotlight page on step therapy reform, and it covers CDC funding and appropriations and pediatric rheumatology and all of these things that really, speak to our heartstrings about why we do all of our advocacy. So once that's available in print, we're going to use it at the Advocacy Summit as our primary leave behind document, and we'll be using it as well in our virtual summit offerings to share with our members of Congress remotely. So keep an eye out for our Welcome to Congress packet and action opportunity that's coming your way soon. Now we're going to move into our ambassador activities for February and March of 2019. We have a number of them, and we're going to do something a little bit new in this call, something that we haven't done in the past. As you know, a number of weeks ago, we had our first round of Arthritis 101 Hill Briefing action opportunities. We reached out to all of you to encourage you to invite your members of Congress to attend our Arthritis 101 Capitol Hill briefing. And what we had done was put together a written guide that would allow you to take a draft of our message and send it off to Congress. We were really, really impressed by how many people connected with their members of Congress and shared the action opportunity with them to join us on Capitol Hill. And we had a really good turnout as a result. But one of the other elements of this program was to reach out to your peers, your friends, your family, and ask them to engage alongside you. Now, we know that not everybody is going to take this written guide, this written packet, and copy a draft message and personalize it and send it to their personal contact over on Capitol Hill. But we do know that a lot of our advocates, a lot of our friends, a lot of our family will take action in 5 minutes or less in our Action Center through one of those links. And we were really pleased. We sent out our reminder email to all of you, and you sent out this link to your communities. And we ended up having 137 messages sent to members of Congress around the country as a result of that effort. So not only did you make the effort to connect with your members of Congress, but we also spread that message far and wide. Now, you can see over here on our map the districts that were reached by our members of Congress, or to the members of Congress and the districts that were reached by representatives by our outreach here. And having 137 messages sent is no small feat, especially when we only had 2 weeks to do it. So think about how we can increase this number by asking our friends consistently to take action by our side. One of the things that we can do, and we want to encourage you to do as you approach future assignments, is to use those links on social media. Post them to your Facebook pages, post them to any arthritis groups that you're in on Facebook, post them on the online community forum, on Twitter. You can send them in an email to your peers, your friends, your neighbors. In the same way that we fundraise, we can also engage our communities to take action. So we want to encourage you to do that secondary outreach to make sure that we're connecting with those other members of our communities and continuing on so that more of this map will be blue next month. We do have a follow-up for our Arthritis 101 briefing ask that connects you guys with the resources that we handed out to our members of Congress and their staff who attended our event. In there, we have another link that will do just this and allow you to do that secondary outreach. We want to encourage you to send, and see what we can do to increase and amplify our impact. My goal is that the next time we meet next month, we can have a map that's a little bit bluer than this one. A word on the Hill briefing, we did have 16 offices that attended this year's event. You can see the list of the names right over here. And we're excited that we had these offices in attendance. We had some really, really great individuals come, and we could see they were really excitedly taking notes and engaging with our panel, asking questions, being a part, and it was a really special thing to see that level of excitement come from our Hill staffers. They weren't just coming for free lunch. They were definitely coming to learn more about our Department of Defense legislative ask for dedicated research with the arthritis program. And so we want to continue the momentum. If you are a constituent in any of these 16 member of Congress's areas, districts, we want you to reach out to them and say thank you. If your member of Congress isn't on this list, we want you to reach out and say, hey, we really were upset that you missed this. We want you to help raise the alarm bells on why arthritis in the military is so important. Here is our material. And so what we've done is put together an Arthritis 101 follow-up guide. And what it does is quite simple. It outlines what the problem is in arthritis in the military. So as many of us know, 1 in 3 of our military veterans lives with arthritis versus 1 in 4 of the general population in the U.S. So that disproportionate impact of arthritis on the military really does weigh on every element of military readiness and our ability to have a fully functioning, fully healthy, fully ready to go military. So we talked through a number of reasons why that disproportionate impact occurs in our military population. And we talk about what some of the consequences might be for our Department of Defense, our military, and beyond. Then we go into what the solution is. As you might know, arthritis does not have a dedicated line of funding at the Department of Defense right now, which means any of their funding can go away year over year, and it makes it really difficult to have institutional knowledge and continue our pursuit of more funding for the arthritis research at the Department of Defense. So what we're asking is that we can call on our members of Congress to support that dedicated line item for our research at the Department of Defense. And when you do it, we have our whole draft email that's ready for you guys to take a look at and personalize and send off to your contacts on Capitol Hill. We also include a phone script that you can use to call your legislative assistants on Capitol Hill and let them know some of these key facts. And then at the end, we have our link that'll allow us to amplify this message. And that link is included in the same way that our last one was. So what we're hoping is we can spread it far and wide. We can use our micro constituencies. We can pay it forward a little bit and see how far this link will go. This assignment, like we said before, will be live on our current ambassador assignment page at the end of today. And what we're going to do is send a follow-up email from today's briefing with the recording, with this assignment, and with the slides from today to let you know about each of those opportunities. We have 1 or 2 other ambassador assignments that I also want to chat through with you. The first is our virtual Advocacy Summit. As you know, our Advocacy Summit is happening next month on March 11th and 12th. And we are so excited to have the opportunity to engage and amplify our message across the country again this year. You may have participated last year in our virtual Platinum Ambassador Assembly, and the steps for engaging were really quite simple. You can see we had these Unstoppable Against Arthritis signs that asked the participants why they advocate for arthritis. You can see Deb Constein here, our Platinum Ambassador, and Stephen Schultz, one of our staff members, holding up their signs about why they advocate for arthritis. The steps are simple. Print out your sign, write down why it is that you advocate for arthritis, what is your one-sentence story, what drives you to be an ambassador. You want to take a picture of yourself holding this sign, and you want to set an alarm. And that alarm should be for Tuesday, March 12th at 12 noon whatever time zone you're in. When that alarm goes off, your job is to post this picture of you and your sign on social media. To take it the extra mile, we want to make sure that you tag your members of Congress in your photo. Include a legislative ask. You can include a link to one of our virtual summit campaigns. Just as we have our DoD link, we're going to have our virtual summit links coming out early next month. And we want to make sure that there's also an opportunity, if you want to use this to fundraise for your Walk to Cure Arthritis, you can do so. Include a link to your Walk team page, because as we share these photos, what we'll see is that our community will like them, our community will retweet them, our community will amplify them, and the more that we do so, the more we can connect with our members of Congress.
Our Empowered to Live Yes virtual summit sign is right here, and you can see that you'll have a space to add in why it is that you advocate for arthritis. And we're hopeful that you can include an element of your story that matches with our Welcome to Congress ask. So we have a number of different priorities there, as we mentioned before. Our top one will be step therapy reform, so making sure that there are no undue delays in access to care and making sure that patients can get the right medication at the right time. And if we can package our stories up so that they supplement this ask, we can tweet these messages out, these images out to our members of Congress. We can send them via email. We can send them on Facebook or wherever it might be to really encourage our members of Congress to join us in supporting step therapy reform legislation, supporting Research for a Cure, supporting our Congressional Arthritis Caucus, supporting our veterans with arthritis, and so on. So we're excited to bottle that up, have these images taken, populate them onto our social media accounts and in emails to our communities, amplify our message, and importantly, share our action opportunities. So we will have a number of virtual summit action alerts that come live in March, and we're excited to have those available for all of you, such that when you post your Advocate for Arthritis photos, that you can include these links and encourage your community to take action by your side. So we're very excited for our virtual summit, and you can expect to see your virtual summit guides coming into your inboxes shortly ahead of the summit, so you'll have time to share those with your communities, take action, and mark your calendars for making sure that we have our flood of images come to our Advocacy Summit right in time for success. Thanks so much. Our next activity for ambassadors is also a forward-thinking one when it comes to your calendars. You may know that the Walk to Cure Arthritis season is right around the corner, and it is our flagship event at the Arthritis Foundation. Our Walk to Cure Arthritis is one of the best ways that you can help to support Research for a Cure. And we want to make sure that we can amplify our ability to impact by offering advocacy resources at the events. Each Walk to Cure Arthritis event will include an advocacy booth where we will have different action opportunities for participants to join in and amplify their voices in sharing their stories to encourage Congress to break down barriers to care for people with arthritis. So some of the things that will be available and what we're looking for are volunteers who can help to administer some of these action opportunities. Some might be to collect signatures for a petition to reform step therapy, to demonstrate in our Action Center an action alert on step therapy reform and encourage people to take action with you in person, and to recruit new members to our program, to talk about the benefits of being an ambassador or an advocate, and to encourage others to join in our program. Another Walk to Cure Arthritis activity that we have always done, that we will do again this year, will be an opportunity to invite your legislators to also attend and speak at the Walk to Cure Arthritis. We have talking points available and a sample invitation that will come into your inboxes later this year, and we want to give you a heads up about that opportunity so that you have some time to prepare. If you are interested in any of these activities, but especially in volunteering at the advocacy booth, please reach out to your state director and to your local staff contact so that we can make sure that your name is included on our list of people who can volunteer. We also have an interest survey that's available on our current ambassador assignment page that we encourage you to complete. By completing it, we'll help you make that connection between you and your state director and the local staff contact, who's the best person for you and your Walk to Cure Arthritis event. We look forward to seeing you at the event and to having you participate as an advocacy steward of our programs at the advocacy booths. Thanks so much for your interest, and we look forward to seeing you. Our next activity is a recurring activity for 2019. As we go through the year, we want to encourage you all to participate in dialogue in our online community forum. We have an Advocacy in Action featured forum in the Live Yes online community. It's really easy to participate in the forum. All you have to do is create a profile, click into the Advocacy in Action forum, and then you can either start a discussion on a topic that you're interested in, contribute to a thread, or even friend someone that you might want to connect with. There are lots of capabilities of this system, and we really want to encourage our advocates and ambassadors to take action. In order to get ambassador credit for this activity, please include 3 posts for the month that you want to participate. And as you go through, we want to encourage you to participate throughout the year. So this activity will come back month after month. If you really have an affinity for it and you want to make this an ambassador activity that you contribute to throughout the year, after you've contributed to your first month, you can consider becoming an Advocacy in Action online community moderator, helping to moderate the discussion. It will contribute to a bonus activity for anybody who wants to become a Platinum Ambassador. So once you've contributed to the Advocacy in Action online community ambassador activity with your first 3 posts in 1 month, we would like to encourage and welcome you to join our community in the future in a leadership role as an online community moderator. And you can reach out to Michelle Guadalupe for any additional information or insight as to how to join as a moderator. And don't forget, as you complete your ambassador activities, to report them in our reporting center. This is an available tool for each ambassador right through our website. You can look down at the Ambassador Program tabs and click into the Ambassador Reporting Center indicated here. Whenever you click in, all of our surveys are available for you to submit in your activity completion and any feedback that you have for the activity. As you do so, you'll receive a confirmation email. And in that confirmation email at the very bottom will be a link that allows you to see all of the activity that you have reported this year. If the online survey system is not your style, we also have a checklist that allows you to write in. You can print it off and then you can write into it the name of the assignment that you completed, the date on which you completed it, and any feedback that you have. Then at the end of the ambassador year, you can feel free to scan and send that into our team so that we can track your activity. You must remember that you'll only be considered for the Platinum Ambassador Award if you report your activities in to our team. Thanks so much for taking the time to listen to our activities, to join us for our call today, and of course, to then follow up with the feedback from any activities that you complete through our reporting center.
To close us out for our regular order ambassador call, we just wanted to let you know and make you aware of future briefings for the rest of the year. Our next briefing will be on March 27th, and we're excited to talk through with all of you our successes from the Advocacy Summit and what we are expecting how we can amplify that message throughout the remainder of the year. We'll also have briefings on April 24th, on June 26th, and on August 21st, and we're very excited to join you there. So with that, I'm going to just switch it over. I know we're at 3:31, so we'll switch into our new ambassador orientation in just a moment. But if there are any questions that you all want to ask, we can certainly answer any of those now. Is there a limit to the number of credits an individual receives toward the Platinum Ambassador Award? Interesting. So there is no limit on the number of credits that you can receive toward the Platinum Ambassador Award. We encourage you to take action on any and all assignments. We don't want you to feel limited to only hit 10 assignments and 4 bonus activities and $1,000. We want you to break through those requirements and continue on. And then, of course, we would incentivize any of our Platinum Ambassadors to accomplish this award with perks like coming over to the Advocacy Summit or any local state capital day. I see what you're saying. We also have in our online community forum the continued engagement. So each month we're going to make sure that our ambassador assignment is reflective of participating in the online forum, and that you can participate over time there. After you've participated 2 times or 3 times in the online community center or received 2 credits for that activity toward your Platinum Ambassador Award, we would ask to see if you would be interested in becoming a moderator for our forum so that we can give you a bonus activity assignment in that space and make sure that the rest of your portfolio of assignments that you've completed are diversified there.
Hey, Julie, this is Keith.
Oh.
Yeah. Julie, this is Keith.
Sorry. Hey, Keith, how are you doing?
Good. Hey, I had a question for you on the Junior Ambassador program. It's been a little quiet since around Christmas, and just wanted to make sure I hadn't missed anything.
No, Keith,
for my
we're
daughter.
going to be sending out our, thank you so much. We're going to be sending out our Junior Ambassador newsletter just next week with very similar assignments here. We were just putting together some new activities for everyone.
Okay. I just wanted to make sure we hadn't missed something for her.
All right, and I saw one final question come in, and it's about bonus activities for Platinum Ambassadors. We'll be including a list of our 2019 bonus activities in our newsletter that will include our recording from this call and any follow-up materials there as well. All righty. We're going to close our question and answer time now, and if you have any remaining, you can feel free to reach out to me at jeller@arthritis.org. That's my email address, and we'll be sure to respond to your email promptly. Thanks, everybody.